Do doctors just not take women's reproductive health seriously? I had very painful endometriosis when I was about 28. I had a female gynecologist and I loved her. She listened to me and we did an ablation. She said she didn't see a lot of endometriosis but believed me when I said how painful it was. Due to my insurance, I had to go through a series of less invasive treatments before they would approve a hysterectomy. I also had painful ovarian cysts. I ended up having a total hysterectomy at age 32. My doc said I taught her a lot about not assuming a person's pain level by what it looks like to the naked eye. I'll give you a non-endo example. I started gaining some strange weight in my late 20s, like my belly was hard. Made an appointment with my doc. He kept saying, "So you're here because you're worried you're getting fat?" Well, no. It was that it felt wrong. I argued with him to touch my belly and tell me if that was normal. He finally agreed and was shocked. Told me that was not normal. Got an ultrasound and a follow-up to discuss in 2 weeks. Before then, one day I couldn't breathe. My sister took me to the and they were trying to tell me I was having an anxiety attack. I have panic attacks, and was confident it wasn't that. I physically couldn't take a breath. I showed them the paperwork with my ultrasound results that I miraculously received that day, and only then did they look into it further. After an MRI, they discovered a gigantic ovarian cyst that had ballooned to about 10 inches diameter. The reason I couldn't breathe was because this massive tumor was pushing against my diaphragm. I was able to get in for surgery in the next couple of weeks. Thankfully, the dismissal I felt at every turn until I got those MRI results was outrageous. I learned a lot about self-advocacy during that time. The best reason I can think that they dismissed it is that doctors are trained on, when you hear hoofs, think horse snot zebras. Basically meaning it's probably the more common thing than the outlier. But the problem is that they don't probe further. They'll be so stuck on horses that they won't even consider a zebra. Endometriosis suffer here. The reason why it takes so long to get it diagnosed is you cannot diagnose it with imaging. It can only be diagnosed surgically by doing a laparoscopy. A lot of doctors are quick to write off endometriosis symptoms if you do not strongly advocate for yourself or if you do not have a family history of it. It is very frustrating, but it's just the way it is. +1. Someone close to me went through this. She had it for most of her adult life, with doctors, friends, and family not taking her seriously, and finally got surgery at the age of 39. It progressively got worse and worse, to the degree that she simply couldn't do many of the things in life that she wanted to. And working was hard, both extremely painful, and sudden and random onset of periods. Before the surgery, she'd typically have 3 to 5 comfortable days per month. That's 4 years ago now. And the remaining issues are minor in comparison. It would be better not to have them. But she happily has a life now. Things changed when she went into a doctor's office bawling her eyes out as she told the story. The doctor promised to see it through to the end. And here we are. I did a fair bit of reading at the time. And one of the things I kept seeing again and again, and also happened in this story, is that the doctors don't believe that the women don't want to ever have kids. Or that they won't change their minds. Or that their husbands might want kids. I mean, what kind of monster would prioritize having kids over their partner being in relentless, excruciating pain? Nope, they don't. I also suffer from endometriosis and was told by numerous male doctors that menstrual bleeding cannot cause anemia, not even when it's heavy, and lasts 10 days or more. I was granted a hysterectomy. Finally. Only after my gynecologist had to tear an IUD out of my uterine wall after it had embedded. She said that my lack of pain response to that told her that the pain I was experiencing monthly had to be a lot worse than what she had assumed. I wish I could have every one of those men fired for forcing me to suffer unnecessarily for years. Doctor here. I've read all the comments up until the time of my posting. Concerns about sexism and racism in healthcare are valid. From a research perspective and from a patient care perspective, the world of medicine is doing everything it can to correct this by forming a culture of diversity and inclusion, and the fruit of those efforts will be seen in the coming decades. I can promise you, in medical school, class of 2016, we were made hyper-aware of everything your commenters are discussing, to zone in a little on the case at hand, and give the op a little faith in the healthcare system again. I'll explain the approach toward pelvic pain and endometriosis. Endometriosis is difficult to diagnose. It is difficult, often impossible, to detect with imaging, CT, MRI. Because of this, it is considered a diagnosis of exclusion, meaning we have to systematically rule out all other potential, and more common, causes of cyclical pelvic pain in women. We do this for two reasons. First, the definitive way to diagnose endometriosis is with surgical exploration, which we want to avoid because it has serious potential side effects. Second, we have an obligation to society to reduce healthcare costs as much as possible. We can't jump straight to an expensive and risky surgery for every patient who might have endometriosis. In your friend's case, a single large fibroid could explain her pain, but they don't harm you per se, and they tend to shrink after menopause. A lot of doctors, I would wager most doctors, would try to wait as long as possible before taking out a fibroid for pelvic pain to avoid the risks of surgery, especially when it might go away on its own. Your friend's young age and her intractable pain are what convinced her doctor to resort to surgery and allow the discovery of endometriosis. Based on the information I have, I believe the best path through her case was taken by her doctor. I hope this helped. And please don't lose faith in healthcare. We're people just like you. We're learning to be better all the time. This happened to me in Pembroke, Ontario, Canada. My female doctor told me, "Don't worry. The female vagina has no nerves. If it did, the female orgasm wouldn't be elusive," and laughed. During the leap, I wasn't given any pain meds. The doctor hung the computer monitor over my head so I could watch my surgery. When I complained of pain and screamed, he started laughing and called in 6 nurses to hold me down until I passed out from the pain. I wasn't told not to lift anything heavy. I was told I could go back to work the same day. My job was emptying a frozen food truck, lifting 100-pound boxes from the truck to the freezer. On my 4th day of work, I felt a tearing and a gushing. I became fecal and urine incontinent, requiring a diaper and leaving my job in food. My bladder, vagina, and cervix fell out between my legs. I went back to the hospital and the nurses refused to let a doctor see me, telling me, "This is normal for a woman your age who has had multiple births." I replied, "I am 25. I have never given birth. I never had this problem before." My doctor refused to keep me as her patient, accusing me of lying about what happened. When I cried telling her what happened, she tried to sedate me and get me treated for depression. She then tried to force me to apologize for lying about my experience, saying, "We always put our patients out for leaps. That doctor who treated you is a hero. Now I am receiving trauma therapy for PTSD, and require anti-anxiety medication. I don't trust doctors anymore. They generally don't." Want another example? Vaginismus. A very painful, from what I heard, sexual dysfunction that causes the muscle to contract and spasm involuntarily and cause a lot of pain during sex. Do you know what most doctors say to that when the patient seeks treatment? Relax. Drink some wine. It's mostly psychological. But there are good treatments aside from the psychological ones. But they just don't care. From personal experience, endo isn't really taken seriously by most providers until you become a patient having fertility problems. Then they are already digging around to explore your body, and it's more likely to be officially found. It really struck me how my endo wasn't really recognized. Despite years of seeking help for pain, trying several gynos, until it was in the context of me trying to have a baby. I do hope the field of women's health evolves to recognize and value other aspects of our lives, lifespan, e.g. not living in pain, having a better menopause, etc. No, a lot of them don't. There is a lot of sexism in healthcare. You can find numerous articles on Google about women who literally have heart attacks but are misdiagnosed with anxiety and/or depression. But doctors tend to take men presenting similar symptoms more seriously. Additionally, medical textbooks are also written with men in mind and do not consider the fact that women can present symptoms different than that of men. So you can't always fault the doctor for not knowing any better. They do not. Women and men display wildly different symptoms to the same issues in some cases. But most medical programs only focus on the men's symptoms. Most medical research and training is done on men. Most medical dummies are male. The problem is history. Most doctors were men. Most researchers were men. They understood how their bodies worked and how they felt. The first women in the U.S. to become doctors graduated with a medical degree in 1849. But it wasn't another 100 years before they become more than a statistical anomaly. Even in the early 2000s, women only made up 1/4 of the doctors in the U.S. Times are changing, however. There are more women than men in medical programs today. In the college campus I just visited, they made it a point to show that they had female medical dummies, including ones that could simulate pregnancy, birth, and pregnancy-related complications. As the older generations of doctors and researchers are replaced by the more even split classes of recent years, and as the push for gender equality in medical research and treatment grows, it is likely that our daughters and granddaughters won't be ignored any more than our sons and grandsons. They don't. And it's because of both original flavor misogyny from men and internalized misogyny from doctors who are women. I do not have endo, but something that causes significant pain, and I was told I was exaggerating many times. I asked for the bare minimum tests I should be getting at my age. 23 at the time. My last OBGYN didn't even want to do a pap smear when I asked. And I was treated like a hypochondriac. Turns out there's textbook precedent for extreme period pain and other symptoms being comorbid with another health issue I have. And also for problems with certain birth control pills. One appointment with my new OBGYN and my issue was diagnosed and solved. I was talking with doctors about this for more than a decade. My other condition was not diagnosed until 20 despite being a genetic, lifelong condition because of the exact same thing. I also discovered recently that my kidney issue was noted on my chart from when I was a kid, and nobody thought to maybe let me or my mom know ever. I had to get surgery a couple years ago because of that issue, and it worsened because I wasn't aware of any problem. I had kidney stones until I was 22 and nobody thought I was in pain. I've lost feeling there. I only read your title, but as a woman, I can solidly say yes. Nope. They think everything is in our heads or because of our weight. In general, if it's specifically about reproductive health, then they only think of future husbands and children. Not about the woman in front of them. Unrelated. but I'm having similar frustrations being taken seriously with my daughter. 6. In this time of COVID, in my experience, if you're having any COVID symptoms, then they automatically want to think that's what it is. Which I guess I understand. To some extent. But many COVID symptoms aren't unique to COVID. My daughter has been sick for a week and 2 different doctors just wanted to pass it off as COVID. 2 negative tests later, I finally got an answer. Pneumonia. She could have ended up in the hospital while I was fighting with doctors to look for something other than COVID. I also had to see 2 doctors before I got a diagnosis and any real guidance about her ankle injury. A few months ago. I digress. But man, it's frustrating. The majority of adult medical stuff is taught with a man in mind as the patient. And as a result, a lot of doctors just don't understand or know women's anatomy. That's my take on it anyway. There's also a false perception that women can't tolerate pain as much as men, which is a very harmful in the medical field. When a woman says she's in pain, often doctors will think it's nothing, and the woman is being too sensitive and/or dramatic. Women are more easily dismissed for pain. Your abdomen hurts? Period pain. Take a Tylenol. KTHX by. There are good doctors out there, but there are also bad ones. In my country, France, the average time to get diagnosed with endometriosis is 10 years. I believe there is very little awareness around this issue even in healthcare professionals. Hopefully it is starting to change. There has always been a tendency to minimize, deny women's pain, especially around periods pain. While I don't struggle with endometriosis, luckily, I have experienced doctors dismissing my concerns regarding birth control. I have epilepsy, so oral contraceptives aren't effective for me due to the medication I was on, so my OB prescribed Annovera for me, which is similar to the NuvaRing. Well, when it came time to take it out so I could start my period, I would have a seizure that night. When it came time to put it back in at the end of my period, I would have a seizure that night. Every single month. I finally stopped my birth control and didn't have any more seizures that were in sync with my cycle. I did have a baby 10 months later, though, smiling face with hearts. My doctor didn't believe it was related to the birth control. It certainly feels that way. There are endless stories like yours. Hell, Elizabeth Blackwell wasn't taken seriously for a large part of her career as a doctor. I've read several of these posts where endometriosis took a long time to diagnose. That really confuses me. I was diagnosed when I was 13 due to the severity of the pain I experienced. Thankfully, mine could be managed with strong medication once a month until I was older. I needed to have surgery years later because it was preventing me from being able to conceive. I feel so bad for women who have had difficulties just getting a diagnosis. At least I knew what was wrong with me. Plus, even though my mother had never heard of it and never experienced any pain herself, she never doubted the pain I was experiencing.
If you enjoyed this video, please check out our playlists full of similar content. TooAfraidToAsk is like doom scrolling for your ears. Please like, share, and subscribe.